As we shared with you earlier in the show, the World Health Organization has designated the new Omicron coronavirus variant as a, quote, variant of concern. The organization held an urgent meeting in Geneva to discuss the potential risks of the Omicron variant, first discovered in South Africa. WHO says that Omicron appears to come with an increased risk of reinfection and likely has a growth advantage over other variants.
According to the National Institute of Health Director Francis Collins, it will take weeks to understand whether it can evade COVID-19 vaccines. Meanwhile, Pfizer and Moderna have announced that they are prepared to reformulate their shots if necessary. Here to help us break down what we know so far about the Omicron variant is infectious disease expert and senior scholar at the Johns Hopkins Center for Health Security, Dr. Amish Adalja. Welcome.
Thanks for having me.
So how can what everyone wants to know is how concerned should we actually be? Do you think we're going to be looking at a variant that is more infectious and more lethal, or is there just nothing to do but wait?
There really is not a lot that the general public can do but wait, because science has to kind of progress at its own pace. I think we have to take this seriously, however, and we have to understand where this variant fits into the whole family of variants that we've dealt with. But what we know so far is that there are mutations in this variant that are suggestive that this might be more transmissible and that it might be able to get around some of the protection, not all, but some of the protection that the vaccines give us. So this is something that's really urgent to understand, but I think it's not a time for panic. It's a time to allow science to do what it does, and for us to do what we know works, by getting vaccinated, by continuing to really be mindful about the COVID-19 risk that's out there.
Well, it seems like the panicking, though, is already underway. But what do we know about the kind of lethality or the severity of the virus? One of the scientists in South Africa who helped to identify it said that it had some unusual characteristics and in some ways was milder than Delta or some other variants. What are the kind of early indications so far?
The early indications are not so much about its lethality. It's likely very similar to other versions of COVID-19. And it's hard to take that South African data and try and extrapolate it to the world, because what we're seeing in South Africa is the people that are getting infected with the Omicron, or at least these ones that have been diagnosed officially, tend to be younger, and younger people tend to have milder symptoms to begin with. So you can't say that that's always going to be the case. We've also heard that the people that are getting hospitalized tend to be unvaccinated, which is good news when you're looking at vaccine efficacy, because that likely means the vaccines, maybe they can't protect against every infection, but they protect against serious infections, and that's what we want them to do. This is going to be something that's going to take a little bit of time to sift through all the epidemiological and clinical data to understand, but I suspect it's not going to be more lethal. It may or may not be more contagious. It may or may not be more troublesome for vaccines and monoclonal antibodies, but I suspect it's going to be of the same level of virulence as other variants that we've seen.
So it's interesting that we're having so much panic about this because from what I understand, there just are not very many cases of this particular variant, even in South Africa. It seems like they just have a handful of cases there. There seems to be a couple cropping up, here and there, Denmark, Germany, Italy, UK, Hong Kong, right? I mean, but it's just one or two. So Netherlands, I think, ended up with the largest amount of 13 passengers having this particular variant out of 61 passengers having COVID. The others must have Delta or some other variant, not sure. But, so really, should we be doing all of these travel bans at this point? I mean, what do you think we should be doing, or what are we shouldn't be doing at this point?
I have never been somebody who supported travel bans, even early on in COVID-19. I think travel bans are ineffectual when you're dealing with an efficiently spreading respiratory virus. They end up stigmatizing places that really do good work and actually alert the world to the presence of a new variant, and they're very leaky. They include certain countries and don't include other countries. All of that tells you that these aren't going to work, but politicians often find the need to do something, even if it might be the wrong thing, and this is kind of red meat to them in a knee-jerk reaction. But what we need to be doing is making sure that we can test, that there's a lot of tests available for people, that we're tracking this, that we're trying to do the science, and as I said, the vaccine likely protects you against severe disease, hospitalization, and death. We have about 60 million plus people in the United States who are eligible to be vaccinated who aren't vaccinated. That's what we need to be focusing on, getting first and second doses into that unvaccinated group of Americans, because that's going to make us resilient not only to Omicron, but to any other variant.
Yeah, and then the travel bans make, exceptions for citizens can evade them, but not non-citizens. Of course, this is not a distinction that matters to the virus, so it's not scientific. Health experts are pointing to global vaccine inequity and hesitancy as the recipe for making the Omicron variant possible. Michael Head, a senior research fellow at Global Health at the University of Southampton, told CNN that the emergence of new variants was a natural consequence of being too slow to vaccinate the world. What can we do to get more people vaccinated? Because my understanding is that South Africa, at least for instance, is not having. It's not really a supply issue. It's it's a messaging issue. It's a persuading people. We can't even persuade everyone here, and we're struggling to do that, or the countries of the rest of the world are struggling to do that too. Obviously, we've gotten lots and lots and lots of people vaccinated, but it's not everyone. So what can you do?
It's not surprising to me that this was first discovered in South Africa, a country where only 25% of the population is fully vaccinated. And it is true that there is a lot of vaccine hesitancy in South Africa. I think what we have to do is do what we know works. It's not necessarily always top-down messages or people on TV telling people to get vaccinated. It's actually engaging primary care doctors, trusted community officials to talk to people and understand what questions they have and get those questions answered. The good thing about these vaccines is that the data is so much on the side of the vaccines that if a person is actually open to persuasion, they can be very easily persuaded just by opening their eyes and looking at how beneficial these vaccines are. But we have to also remove export restrictions. We've got to get more vaccine into people's arms around the world, because this is not the last variant that we're going to see from COVID-19. And if we don't think about this pandemic globally, in terms of trying to make the whole world or the whole human species resilient to it, we're going to continually have these types of scares and new discoveries with variants that end up disrupting everyone's lives and causing a lot of problems, which could easily be prevented if we just had more vaccine in people's arms.
And Doctor, what if we find out that we have to modify our vaccines or tweak them in some way to deal with if there is a getting around the vaccine that Omicron is doing? How can the FDA approve this faster? Can the companies do this a lot faster than the last vaccines were? It was a lightning speed process by the standards of medical approval, but I think people want it to be even more faster now. Are there shortcuts that can be taken given that we already have the vaccines and they're just slight changes, or how does that work?
I wouldn't characterize it as a shortcut, but the elegance of the mRNA vaccine platform is that you can just modify it very simply. And companies have already been doing that. They've actually do that with every variant to see if they can make a vaccine very quickly. To scale it up into industrial style production, probably 100 days is what we're hearing from those companies. But this isn't something that's unreachable if it's necessary. And the FDA does have expedited pathways for booster vaccinations and for updates that would allow the regulatory process to work as seamlessly as it could. But I don't think we're at that threshold yet. But the fact is, this is one of the major advantages to mRNA vaccines, that they can be modified on the fly like this very easily.
Right. And Doctor, what is it about COVID that makes it so that younger people are more resistant to it? And are there any mutations that are concerning in any of the variants that you've seen that could implicate that kind of general structure, or is there just something about COVID that's going to leave that disparity in place?
This is something that's common with many respiratory viruses, that the elderly or as you get older, that the likelihood of a severe disease becomes more common. And that's definitely been the case with COVID-19. And that may be due to changes in your immune system. It also has to do with the fact that as you get older, you're more likely to get comorbidities that are important for COVID. So diabetes, obesity, being overweight, hypertension, all of those things that synergize with COVID-19 are more common in the elderly population. And you just have less physiological reserve. So there's myriad reasons why older individuals are more likely to have severe disease. And it has nothing to do with any kind of mutation or anything. It's just sort of how the immune system interacts with the virus. And much of this is still true for influenza as well, and RSV and other respiratory viruses that impact the elderly much more significantly than the younger populations.
Yeah. Last question. Representative Massey tweeted that he thought this variant, the Omicron, is already in the U.S. Do you think it's already here? There are already cases of it in the U.S.?
I suspect that's probably the case. We don't sequence all of our cases. We don't test all of our cases. So this is not something that I would be surprised to see in the United States. It's already in North America. There are cases detected in Canada. We know that there were cases in Belgium that had no contact with those South African countries. So it would not be surprising that we discover this, so that there's an announcement later today that this is around. And probably that's not even the first case. It's probably been here at a low level, percolating along.
Yeah. Thank you so much for being with us. We really appreciate your expertise.
Thanks for having me.
Tomorrow on Rising, we'll continue to update you on the developments with the Omicron variant.
And Brian Charles will be here to discuss the Defund the Police movement in Baltimore.
Don't forget to like, share, and subscribe so you never miss a video. See you tomorrow.
See you then.